Total hospitalizations, click down, still in the 18,000, but a click down. Good news. That's a fact. It's a fact. That is good news, not my opinion. You see flattening of the curve, all these new expressions that we never used before. Plateau, flattening, rounding. Net change in hospitalizations, down. That's good news. 3-day rolling average, because remember, any one of these days of reporting, this is a new reporting system. It's imprecise. I wouldn't bet the farm on any one day's numbers, but a 3-day average starts to be a little more accurate. ICU admissions is down. That's good news. Intubations are down. That's very good news, just on a real-life level. When a person is intubated, they're on a ventilator, 80% of the people will never come off the ventilator or thereabouts. So that's good news. Little reality check. You still have, on a day-to-day basis, about 2,000 people who are being diagnosed with COVID. So we're out of the woods. No, we're still in the woods. The good news is we showed that we can change the curve. Good news is, great news in my opinion, we can control the spread. That is great news, because can you imagine if we couldn't control the spread? If we did all this and the spread kept going up. So we can control the spread. But you still have about 2,000 people a day who are new diagnosis coming into the hospital system. So it's still a serious public health issue. Lives lost yesterday, 752, which is the painful news of our reality day after day, and they are in our thoughts and prayers. You see 707 in hospitals, 45 in nursing homes. People are interested in those numbers and how those numbers are changing. But you see the terrible news has basically been flat over the past several days. Again, the number of deaths is a quote-unquote lagging indicator. It's almost disrespectful to put it in scientific terms. But these are people who were probably intubated, they were on a ventilator, and then again, a period of time on a ventilator normally has a bad outcome. On the ventilators, we've stabilized our healthcare situation. New York had one of the earlier curves. There are other places in this country are now seeing increases in the death rate, and they're seeing stress on their healthcare system. I will never forget the generosity that people across this country showed to our state. And I said at that time, New Yorkers are generous and they are grateful and gracious, and when you need help, we will be there for you, and we will be. State of Michigan is going through an issue right now. State of Maryland is going through an issue. We're stabilized. We're going to send 100 ventilators to Michigan and 50 to the state of Maryland. Any situation in public where you cannot maintain social distancing, 6 feet. If you can't maintain that social distancing because you're going to a congested area, or it's a situation where you can't maintain social distancing. You cannot maintain social distancing on public transit. You can't. You can on a street that is unoccupied, but if you're going out for a walk and you may come to a place where you can't maintain social distancing, you have to have a mask. But in the meantime, what do we do today? We have to continue to stop the spread. This is a constant calibration also. I'm going to issue an executive order that says all people in public must have a mask or nose covering, mouth and nose covering, and they must wear it in a situation where you cannot or are not maintaining social distancing. Meaning what? Meaning the same thing we've been saying from day one. if you're going to be in public and you cannot maintain social distancing, then have a mask and put the mask on when you are not in socially distanced places. You're walking down the street alone, great. You're now at an intersection and there are people in the intersection and you're going to be in proximity to other people, put the mask on. Your right to go out for a walk in the park, go out for a walk because you need to get out of the house, the dog is getting on your nerves, fine. Don't infect me. You don't have a right to infect me. If you are going to be in a situation in public where you may come into contact with other people in a situation that is not socially distanced, you must have a mask or a cloth covering nose and mouth. That is by executive order. So if you're going to get on public transit, you're going to get on a bus, you're going to get on a subway, you're going to stand on a subway platform, you're going to walk in a neighborhood that is busy, you're going to be on a sidewalk, you're going to pass other people on a sidewalk, you're not going to be able to maintain social distancing, you must wear a mask. Or cloth, or an attractive bandana, or a color-coordinated bandana, cloth, but you have to wear it in those situations. We'll give people 3-day notice to allow compliance, just on the off chance that somebody doesn't have a cloth covering. Provide financial assistance to state governments so they can do their work. I have to go to work.